Hi, everyone. Thank you so much for joining us today. We're here with our next edition of a Healthier You series here at Oswego Health. Today, we're getting to talk about mental health. We know the pandemic has impacted us all in different ways, and May is Mental Health Awareness Month, and we wanted to talk with you about mental health so that you also feel comfortable talking about mental health with your loved ones. So I'm Katie Peglaroli. I'm the Corporate Director for Integrated Healthcare, and today I'm joined by Dr. Omar Colon. He's our Director of Psychiatric Services here at Oswego Health, and Dr. Tina Stassin. She's one of our psychologists. Thank you both so much for joining me here today. I'm so happy to be able to speak about this with you and let our community know what we do to talk about mental health. So I'm going to start with you, Dr. Colon. The pandemic has really changed our lives a lot in one way or another. Everyone's been impacted by it. What are some ways that we can monitor our mental health?
Well, first of all, thanks, Kathy, for giving the opportunity to talk to everyone over here in the community. And also, good afternoon to everyone. And what the first thing that we have to know about the pandemic, is something that have been affecting all of us. We are talking about families, kids, even elderly. So it's affecting us all ways around, even jobs, even our schools, or even at home as well. So it's very important to know what we can do to know about our mental health and how we can monitor it. So why is so important? Because sometimes we might feel some symptoms that might be affecting us during this time. Sometimes we might feel depressed or anxious. Those are the most common symptoms that we might experience. Now, we have to keep an eye on this because sometimes we might try to see if we can go and see, like I say, monitoring it by talking to our primary care physicians to make sure that we are healthy enough or we are following up with our recommendations from them. Also, we have to check on our health, making sure that we're eating healthy or we're sleeping good enough during the night. All of these things, we have to keep an eye on them. Now, let's say these symptoms start becoming too severe enough that start affecting our life. In these particular cases, then we might start saying, this person might start experiencing more depression or anxiety. We have to keep an eye on these symptoms, such as feeling sad or feeling like we're not enjoying activities like we used to enjoy before. Sometimes we might not be sleeping well at night. We might sleep too much or too little. We also have to keep an eye on our concentration. Sometimes we might not be able to focus too well at work or at home or even at school. So these are signs of depression. We also have other ones as well. Sometimes we have a lack of energy. Sometimes we feel fatigue, or we might feel on the edge or very anxious as well. Sometimes irritable is another sign of depression that we might see in our kids as well. And sometimes some of our patients or some of our people might experience also some symptoms of hopelessness or helplessness. And we also have to keep in mind when people having thoughts about harming themselves or others. So it is important to keep this in mind and how do we can prevent it or how we can look for help for it. So sometimes we have to, if we can, we should keep our numbers close to us, like about a place or a facility like our hospital, like our Oswego hospital, or a clinic that is close to us, or a provider, or a number such as the suicidal hotline or anything like that. So we can have information enough just in case that the symptoms become too severe.
That's a really great point. And I'll be able to, I think, post those numbers for us when we post this to our Facebook. We'll be able to put it in the comments. So that's a good point, and we'll be able to provide those numbers for you. Thank you so much, Dr. Colon. Dr. Stassin, we know our children have dealt with a lot of changes through this past year, especially with the schooling changes, maybe being isolated from friends and family, having those same things that we were talking about, possibly fear and anxiety. What are some ways that parents and guardians, we can help our children cope with the stress and anxiety of the last year?
Oh, it's so huge. How it's affected everyone, families, the children, the parents. And parents are in the best place to help kids by doing things that are healthy anything that you can think of. Dr. Colon talked about depression and watching for that and how it might affect you. Well, doing things that are like, if you're to get good sleep, he said you don't feel like doing what you used to do. So getting exercise, getting outside and getting fresh air, interacting with other people to the extent that you can, is all those things, any things that help us feel good in a natural way go a long way toward helping our mood and fighting off depression when we're sad that we can't see people that we want to see. A lot of kids have been struggling with the school issue and going to virtual learning. Now, I do have a couple kids who have gone on the honor roll for the first time. They've got one-on-one help at home and they are blossoming. By far and large, most kids are really struggling with the distractions at home, with the pressure of this different way of learning and not being in touch with their friends. So any support that you can give your child for learning, it could be to go to the museum if they're studying history, to make that more real to them and make it fun. We just have to, we are inundated here with kids struggling with that. And sometimes we're coming up with innovative ways. Some kids have gone back to school more when they find they really just don't learn well. One thing that a lot of people haven't thought about is vision issues. We've had some kids with vision issues that absolutely can't make sense of things on the screen because their visual processing isn't up to par. I mean, they've got some issues with it. And so the school has to accommodate that, or they're back in class and doing great. So those kind of things are very, very helpful. Specifically, it's just about what you can do with your family. Resilience is a word that's batted around a lot, and that means to overcome challenges. And definitely what you can do is, the more positives in your life, the more you hug your child, the more you do things and give them attention, the more resilient they can become. I would advise parents to use validating statements. And that means to help them know that you get their struggle. Parents, it really helps when parents say, wow, that's really tough, whatever the situation is, and talk specifically, yeah, that is harder to get this information from this video instead of your teacher. And what can we do to kind of make this better for you? Those kind of validating statements go a long way to help the children feel being heard. And when you feel heard, you feel better. So both the validating statements, interacting in a positive way. I'm going to throw one more thing out.
Yeah.
Help your child with self-talk. We can always, when we start feeling overwhelmed, it's like, I can't do this. I can't stand it. I don't care. If you hear that, talk to your child, because those thoughts impact how we feel. And if you can help your child say to himself, I really do have a lot of good stuff going on. I can handle it. I've got support. That's huge. It really, really helps in these really rough times that are quite a struggle.
Yeah, I think that's so important. That's a great point. And I would say, hey, adults, you also give yourself some good talk, right?
Yes.
Doing the hard work, especially helping our children through this. And I think those were really great things that you recommended. Thank you so much.
You're welcome.
Alone, talking about that support, how do I offer emotional support to family members who might be having a tough time? Is it okay if I see someone who I think may be struggling to ask, I see you struggling. How would I do that? What are some things that I could do to help those around me?
So for me,
Yes. Yep.
Okay, so Kathy, yeah, definitely. There's a couple things that we have to keep in mind. We are in a pandemic, and it's not as easy to communicate with everyone. So we definitely have to keep in mind, have phone numbers ready to call our family ones or our loved ones. We also should have, if we can, some sort of way of communicating through computers virtually, and that way we can continue to see them and continue in a constant interaction with them. That way we can monitor or see how they're doing, how they feel during this situation. And because it's stressful for everyone. The same way is if they notice, if they notice any change on their loved ones, it's okay. It's okay to ask the questions, how have you been doing? Sometimes it's good to also even say certain things of how we are feeling ourselves too. You know, sometimes by telling somebody else that we also struggling, that helps them to open themselves up and talk to us in more ways. It's important, all these things, because like I mentioned, there are certain signs that we might want to notice, and we might want to make sure that they are getting the help when we observing this. And if for some reason somebody really needs the help and they cannot reach it by helping their loved ones, we should also have a way, or having hands numbers to contact, like our mental health facilities or our providers, so that way we can give them a hand too as well and help them.
Thank you.
Yeah.
We did post those in our chat for you guys. So if you need that number to the suicide prevention line 24/7, we made it available. Dr. Stassin, you were about to comment. Sorry about that.
Oh, I'm sorry. So I think about what helps me feel not alone. So it could be as simple as waving at your neighbor. We don't, or just stopping by to chat. Now outdoors is more safe, and we've got the new guidelines. Maybe celebrate the new guidelines where we can be outdoors with vaccinated folks. And I see a lot of my neighbors are having their fire pits going, and having a little gathering, because we're the adults are vaccinated, and we need that time to relax and unwind. But like I said, it's just saying hello, walking your dog, saying hello. And if you know somebody that might be struggling, check in on them or drop them some flowers, anything that you normally do for folks who are struggling is probably really appreciated at this time.
That's a great point. And just some of those things can go a long way to helping us, just checking in, doing something nice, get outside. I know today's a beautiful day out here in Oswego, New York. So it's nice to see. So we'll encourage everyone to increase those endorphins, get outside a little while. Well, this has been very, very helpful. Thank you so much. It's really an important topic to talk about. And I love that idea of resilience, as we're all recovering, right? This is something that's impacted us all. So Dr. Colon, to your point, say something to someone else. It could be that they're feeling the same way that you're feeling. We're not alone in this time. And we've come together over the last year in a way that's really impactful and remarkable. So I hope that we have answered a few of your questions out there to our Facebook family who follow us here at Oswego Health. We have all of our Healthier You are recorded, and they're posted for you here or on YouTube, so you can go back and watch them. And I hope that you'll revisit this. It's an important topic. And I really want to thank our guests today. It's been really informative, and we appreciate your time in joining us. We will see you next time on another edition of A Healthier You, as we give you care here right at home.